BD PowerGlide Pro. It's a 10 centimeter, 20 gauge midline. And it's got a fairly slick kit. Honestly, the hardest part is opening it, but one of the rules of thumb where it has this little green label on the opposite side, it opens from the center. You can compare it. And so what's inside here is your self-contained midline, which we'll go over in a sec, and then an adhesive attachment tool, and then your label. What you'll need also, if you want to do this kit, is you'll just need a J-loop that you flushed, and a clave to attach to the end of it. Our J-loops at hospital center have the claves already attached, but some of you would not, so you just need to put a clave and just make sure it's flushed and ready to go. We're going to do this with aseptic technique. You don't have to be sterile, which means you can have an ultrasound probe cover or a tegaderm on the end of it. What we have here is we've got this model where we have our vessel here. And what you're going to do is essentially you have this kit, and it's got a couple little things on it. One, this purple slide in the middle progresses your wire, right? And so you're going to progress your wire when you're ready to capture the vessel. And then these wings on the side that are pink actually progress your catheter forward once you're ready to put your catheter. So it works essentially like a peripheral IV otherwise. What I would recommend is doing an over grip when you're actually hands on top rather than pencil grip. When it comes to flattening your catheter when you're getting towards the vessel, it's pretty hard to do so with your hand underneath it. Whereas above it, you've got a lot more room to flatten. The next step that you want to think about is entering pretty close to your ultrasound. In fact, actually where I'm entering the skin is directly under the ultrasound. Most of the time, these vessels are pretty superficial. And so if you enter with the space between where you're entering the skin and where your ultrasound probe is, by the time you see your needle on the screen, you'll often be past the vessel or already in it. And so you want to enter almost underneath the ultrasound, right? And so if you look at the ultrasound right now, you can see the screen, you can see my needle tip right at the center, right? Now, one of the keys here is you want to make sure you're on your needle tip and not your shaft. And what I do is I basically move my ultrasound up the arm until I can't see my needle tip anymore. So my tip is gone away. Now I move my needle again, and now I can see it again. And then I move my ultrasound so my tip goes away, and I see my needle tip again. Ultrasound, tip has gone away. There's my tip again, right? And I'm essentially doing that back and forth motion until I get all the way down to the needle. Right, inch by inch. I like to really move my ultrasound so the needle tip completely goes away rather than trying to follow it in view the whole time, because I find if you try to keep it in view the whole time, you tend to move your needle past the tip, and now I'm on the needle shaft and it's harder for me to see where I am. Whereas if I keep moving it until I can't see the tip anymore, I can be certain that every time it appears, it's actually the tip. You see, I've made it all the way down to the vessel wall, right? So now when I'm at the vessel wall, what I'll do is I flatten my needle as far as I can. And again, this is where this overhand grip is very useful. And again, I progress my probe until I no longer can see my tip. Then I move my tip a little bit. You see how I can see it again? I move my ultrasound probe so it's gone. Tip, probe gone. And I keep doing this until I get it to the vessel. And now you can see how my needle tip is in the center of the vessel there. Now, before I thread my wire, I actually want to walk the needle up the vessel farther to make sure I'm in the center of the vessel. So what I do is I make sure I'm flat. So I'll move my ultrasound till the needle tip goes away. Then I move my needle again. You can see it. And now I'm slowly walking my needle up the vessel. I'm getting towards the back of the wall, so I probably kind of walked up the vessel as far as I can without damaging the posterior vessel. Right, so at this point, I will now pull back a little bit, and I'm going to progress my needle. So my finger just comes to the purple slide, and I slide this forward till I feel a click. Once I have a click, it's in place, and my wire is now in place. Nice. And now what I can do is I can put down my ultrasound. This hand is holding my needle in place, or my catheter in place, and I'm not going to move it. And then I'm just going to take with these two fingers, grab the two butterfly, and because I'm going to push that forward, right? And it basically goes forward until it slides into place, right? And then I can pull my needle out the back. You've got a little stopper on here now, right? So this little stopper, the plug, you won't back bleed at this moment, right? And so this gives me an opportunity now to clean the patient with gauze. I can wipe off all the ultrasound gel. I'll just kind of make sure I get all the ultrasound gel out of the way. basically you lift this up and then you can just pop it off, right? And now you'll start to back bleed, but you have your J loop ready. It's already pre-flushed, and you can just connect that, pull blood back, make sure you're getting blood return, and then you can flush the catheter. The final key is just securing it in place. So they come with these little adhesive securement devices. If you take a close look, there are these two little wings or bumps on the sides here. That in lines, if you look on your catheter, you see on the pink portion, you've got those two little nubs on the outside. Those two things should come together, right? And so I just make sure that those are in line, and then I'll push down on the securement device till I feel a click, right? Once it's clicked, these two things are together, and now I can secure it to the patient. And so you have these wings, and I can just grab this little part here that says snap lock, pull that out, and that will, it's like hybrid tears, but it essentially will adhere to one side, and then I can do the same to the other side, and we're in place. The last thing you want to do is make sure you have this little label that says PowerGlide. This is to indicate that this line is a midline. So when the patient goes to the floor, to the ICU, or wherever they're going, we can make sure that everyone is aware that this is a midline and not a pink. And so we'll just take this off. And we just secure that to the J loop. Like so. That's it.